Did I scare you? If you hear purring, that is Percy. He's got a motor on him right now. So, if you saw my community post that I made, like, a couple weeks ago, that's a real picture. I took that on my cell phone, at around 7:30 p.m. on a Tuesday. Just average Tuesday for me. And I'm gonna explain what happened in that picture. This is gonna be your scary story for Halloween, by the way. So, it's about 4 p.m. I'm coming home from school. My mama's picked me up, and we're about halfway home. And then my ear starts hurting, like on the inside near the top, you know. So I was like, huh, that's weird. I'm gonna touch it, see what happens. And so, in doing that, I propped my hand up on my face. And so I'm playing with my ear. And I'm like, wait a minute. My face is numb. I can't feel my hand on my face. And so, I turn to my mama and I'm like, my face feels funny. And she goes, huh? But luckily, we were right next to my doctor's office, so we went there. And in saying that my face was numb, I'd kind of started having a panic attack. My heart started racing and stuff, and I was having trouble breathing. So we get in there, and someone that we know was also in there for a pre-planned appointment. Appointments are always pre-planned. But she was in there for an appointment, so she's talking to my mama. She's like, yeah, DK's face is numb. And then the little doctor lady calls in for the person that we knew, and she was like, hey, can they go before me? Y'all need to get this kid straightened out. So we went before her. And so I get in the little room, and they take my heart rate, they take my blood pressure, and then the little lady leaves. She also grabbed my symptoms and was like, huh. So then she leaves. Student doctor comes in, takes my symptoms, leaves. They come back with an EKG, which if you don't know, it's something that tests your heart rate. They really only do it if it's dangerously high / unhealthily high. So basically they put a bunch of stickers on you where you can feel your heartbeat. They hook these little clippy cables to them, to the stickers. And then you have to lay really still, and then it takes your heart rate. And it comes out in graphs, by the way. So she takes it 2 or 3 times. And then my actual doctor comes in and she's like, well, your heart rate is 110. You're gonna have to go to the ER. Great! 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 They have no idea about my other symptoms. All they know is I'm not having a stroke, which I guess is a good thing. And so, at this point, my face hurts and is numb. I'm shaky, I'm hyperventilating, my heart rate is through the roof. So we just go into the ER. It was further away than I would have preferred it to be, but I can't really control that. So we get in there. I walk in while my mama parks the car. And then my dad comes in. He works I want to say 5 minutes away from there. So, he got there pretty quick. And he was like, have you done anything yet? And I was like, no, I literally just got here. So, we talked to the front desk lady, give her all my symptoms, give her my insurance card, and then we sit down. Mom comes in, my mama comes back in, maybe at this point my papa comes in, I can't remember. So then they take me into this little room. they take all my symptoms again, and then they ask me a few more questions, like, what's your name? How much do you weigh? How tall are you? Is there anybody trying to hurt you? Or are you trying to hurt yourself? When was your last period? And so then after that, we go back into the waiting room for what felt like an eternity. And then I get pulled into another room. They ask me all of the same questions again, just to make sure things are staying consistent, I guess. And so at this point, so before this, okay, the pain and numbness was on my right side, sorry. It was on the right side of my face, like, kind of on my jawline. And then, around this time, it moves to the left side of my face, like a little bit higher up, around near my temple is, or where my ear is. And so, the doctor man, he goes to take an IV. And so, like, he stabs my right arm and is trying to get the vein in place, but he can't because apparently my veins move. And is like, we're gonna have to try the other arm. And then when he goes to try the other arm, these people carrying an x-ray come in. And so they do a chest x-ray. Oh, and they also did another EKG, by the way. And I don't remember how it came out. And then after that was done, and he was trying to take the IV on the other arm, another person comes in and is like, okay, we got a room for you. And he's like, well, they'll take care of you in there. I was like, why do I even try? So we get into my room. I lay down. They take my IV again. They hook me up to the little monitor with the little finger cast thing. This time they actually get the IV in. It didn't actually bruise, unlike the other one. I'm filming this, like, a week after this happened, so, it's not really tender, but you can still see the bruise. Anyway, and then she was like, okay, I'll be back, we're gonna get, a CT loaded up, and then we'll do that. She also gave me a warm blanket, which was so nice. And then we waited. And then, she came in and gave me, like, 2 pills. They were, like, very brightly colored, actually. But she gave me a couple pills. And she didn't say what it was. She was just like, it's gonna make you a little bit sleepy, but whatever. So I take the medicine, I keep my little water cup, because I am thirsty. Keep in mind, I had lunch at noon. That was when I last drank something, was at noon. And it is now about 6 p.m., so I am parched. So I keep my little water cup. I didn't know if I was allowed to refill it or not, so if I didn't, I just threw it away. I wish I didn't, though. But anyway. And then, like, a little while later, I was like, man, I gotta use the bathroom after consuming 1 cup of water. And so... Oh, I forgot. When they hooked me up to everything, they also put a, oh man, what was it called? A BP machine on my arm. But I was like, man, I gotta use the bathroom. And so Mom, grabs a doctor, and he unhooks me, and gives me a cup and a little wipe, so that way they can take a urine sample, just in case. They actually, I don't know if they ended up using it or not, but, like, when they discharged me, it was still in the room, like, filled up, so I don't know. But that was an uncomfortable experience. That took way longer than I really wanted it to. But a little while later, they got the CT loaded up, and then some lady came in with a wheelchair that I was supposed to sit in. And, like, I sat in it, obviously. I mean, I could still walk, but, like, I took it. So they drag me into the CT room. I do the CT. It whirred around my brain. And then when it was done, she came back and wheeled me out back to my room. We were in there probably another hour. So some bald guy comes in and is like, telling me about everything. Like, he gets my symptoms and stuff. And my mom was like, hey, the VP is kind of high, huh? And, like, he turns and is like, oh, yeah. Anyway. But then he was like, we'll see what the CT says. Peace. So then he leaves. Comes back a while later. This is going to be a common pattern. For some reason, the ER takes so long to do everything. I understand they have, like, a bajillion different patients. But, like, I was, like, so anxious that I thought I was dying of a stroke. And, and also, if they think it's because of anxiety, because my doctor said it was probably because of anxiety, why don't they hurry the process up so that way my anxiety doesn't get worse? I don't know. Anyway, so Wild Guy comes back and he's like, everything's fine. I don't know what to tell you. That's essentially what he said. And so he's like, I just have pictures. I don't have a video. I don't know if, like, it's gonna change at all. And my papa was like, oh, are you gonna get that soon? It's not how that works, but I thought it was funny. And I was like, is there a chance it could be because of anxiety? And he was like, well, anything can be caused by anxiety, so, like, don't brush it off, I guess. It's like, that's why we're here, is to get an answer, but whatever. They tried to prescribe me, like, a couple different medications, but I don't know if they really did. And so, again, it is 8 p.m. Well, about 8:30, so. I haven't ate anything since noon. I usually eat dinner around, like, 6. I'm starving, but also nauseous because I am so hungry. So we ate at, this little, I think it's a Japanese place. I could hardly eat anything because I was so hungry and so nauseous that I physically couldn't eat anything. And also my tongue went numb, briefly. So that was cool. We went home, I writhed in agony. Next day, they apparently had given me a doctor's excuse for, the very next day, Wednesday. So, obviously I took it, because I was writhing in agony. And so I feel like I should mention, I am very paranoid in this current situation, okay? My face is numb, I can't feel it, it hurts. I am afraid I'm having a stroke, so I'm constantly checking my face to see if I'm having a stroke. Like, I'm looking myself in the mirror, I'm feeling of my jawline to see if, like, my skin is falling. And, like, I was so scared, I guess, is the best way to say it. And so, next day, I take a shower, my mama picks me up, and I pretty much just hang out at her house all day. It was awesome. And I was like, ugh. Like, I was not having a fun time, even though I was laying in bed. I was not having fun at all. So then, whatever, next day, I have to go to school. And I was not having fun there either. I was so tired because I've gotten hardly any sleep. Because I keep waking up in the night and my face hurts. And I'm like, oh my god, I'm having a stroke. So, like, in the middle of third period, which is about 11-ish, my chest starts to hurt. Like, really hurt. Like, right in the middle. I don't know if that's where your heart is, but so I text my mom and she goes, tell your dad. I don't know what to do. So I text my dad and he goes, go to the nurse. And I said, okay. And so I go down to the nurse. She takes my BP. She takes my heart rate. And she's like, everything looks fine. Maybe you're just dehydrated. Then she gave me a bottle of water and I left. So that was extremely helpful. I don't think anything else of interest happened that day besides pain and suffering. Oh yeah, my right arm, which has been completely not a part of the conversation, like from elbow to my ring finger and only my ring finger, straight pain. From like 4th period to like the whole day. 4th period for me is about noon. So that was even more fun. Next day, Friday. So we do this thing called Red Hound Olympics. Red Hound being our mascot. So Red Hound Olympics is when speech and debate, which I was a part of, interact, track, dance, and football, and maybe one other club. They hold not really an Olympics thing, but like a station passerby for the 2nd graders who are learning about Greek mythology. And so they come and there's a bunch of Greek stuff, I don't know. And the second I came back from that, straight pain in my face. Only on my right side. Again. And remember how I said I was really paranoid about it? I was really, really, really paranoid. Like, I kept moving my eyebrows, flaring my nostrils, like, smiling and, like, doing the duck lips. Like, doing that over and over and wiggling my ears to make sure that I could still move my face. Because, fun fact, facial numbness is also a symptom of Bell's palsy, which might just be a stress-induced thing. Let me look. The Bell's palsy can be a reaction to a viral infection, but it is also a stress-induced infection, question mark? So basically, your face droops a little bit, your face is numb, you can't move, like, that part of your face. I wasn't really concerned I was having that. I didn't care about that. I was more concerned about me having a stroke. And so, like, again, I kept moving around my face. So, next day, Saturday, I was going trick-or-treating. So, at this point, the pain... Okay. So, the pain is very inconsistent. Like, sometimes it'll hurt in my teeth. Sometimes it'll hurt in my ear. Sometimes it'll hurt in my temple. Sometimes it'll hurt in my head. Sometimes it moves around. Sometimes it's just straight pain in my face. Like, it really just depends on the day. It would also hurt to, like, chew and talk for long periods of time, like I'm doing right now. So, yeah. Symptoms muddled. So, Saturday. Straight pain in my face. Fantastic. And also the pain would be so bad that I would get dizzy, / lightheaded, / have an unstable gait. Not fun. And so my costume has like these platform almost boots. Not really platform, but they have like a heel to them, you know? So I was walking around not a trailer park, but an RV park, in high heel boots with slight dizziness, I'll say. Oh my god, that was the worst time of my life. I mean, I had fun wearing my costume, I had fun seeing other people's costumes, but that's the only way I can describe this situation is sorry. So we have to go home like a little bit early because I am in agonizing pain. Okay? So, like that night my mom was talking to me and she was like, hey, my boss thinks it might be TMJ because he has similar symptoms and he has TMJ. And so TMJ, it stands for teeth moving jaw. I don't know if that's what it stands for. But essentially, it's this condition where you grind your teeth in your sleep so much that it, like, brings your jaw not necessarily out of socket, but it moves it back, which can cause nerve damage, but it also causes, like, joint pain, it causes facial numbness, it causes, like, pins and needles, bunch of other stuff that's fun. So I was like, oh yeah, that makes sense. Yeah, sure, yeah. Sunday, I feel fine. Like, that was probably the only day where I felt absolute release from... Well, I mean, it started hurting in the evening, but that's besides the point. I felt free. Again, it started hurting in the evening. Monday. I was supposed to get in the doctor's that day to discuss the symptoms. That did not happen. It got moved next day. Whatever. My dad picked me up that day. I don't know why I mentioned that. That has nothing to do with anything. I was supposed to have a speech and debate practice, but the new coach is being, kind of unreasonable, so I didn't go. Also because it was canceled. But Tuesday, my doctor's appointment. Which was yesterday as a filming, fun fact. So, let me refresh for everybody. Facial pain causing numbness and pins and needles. It hurts in my teeth, ear, and by my temple. Sometimes it hurts in my head. Sometimes it hurts, like, on other parts of my body. Signs are leaning towards nerve damage, an ear infection, wisdom teeth, but most importantly, TMJ. Get in the doctor. I tell the lady all my symptoms. She takes my blood pressure and my heart rate. She leaves. Student doctor comes in. She talks to me. Right? We're having a nice little conversation. She takes my symptoms. It's like, and so I was telling her that I was, like, really anxious about this, and she was like, do you have, like, anxiety/panic attacks often? Like, about how often would you say a week? And I looked at her, and I was like, mm-mm. And she was like, so not even every week? And I was like, no, it's like once a month. And she was like, do you grind your teeth in your sleep at all? And I was like, I at least used to. She was like, do you grate your teeth? And I was like, oh, definitely. So then she leaves. My doctor comes in and she's like, it was just a panic attack. Lol. And it's like, yes, my heart rate and BP spiking to unhealthy levels was certainly my anxiety. I don't know about the facial numbness. I don't know about that. But she was like, we're gonna up your Lexapro, and then I'm gonna give you a pill for when you have a panic attack. It takes 30 minutes to set in. Why? If it's for a panic attack, you know, something that typically lasts less than a minute, why would it take 30 minutes to set in? Riddle me that. And I was like, hey, what about my jaw, though? And she's like, you're gritting your teeth too much because of your anxiety. And I was like, I mean, I guess, but I don't think that's entirely accurate. So then she pressed on, like, kind of near my ear, and she was like, okay, open your mouth. And so I did, and I closed, and she was like, oh yeah, I feel it popping. You're gritting your teeth too much. I would recommend going to the dentist and seeing about a mouth guard. I wish there was, like, a one-stop shop doctor that, like, was a doctor, but was also, like, a physical therapist, and, like, a dentist, and, like, an orthodontist and dentist are essentially the same thing. But, like, an optometrist. Like, somebody who can do everything and get all my symptoms and hook me up to several different things to try and, like, run every single test imaginable on my body. So that way I know what the problem is. But that's too good to be true. So it's a week later. I just went to the dentist, and I have TMJ. Yay! So, if you don't know what that is, TMJ is essentially this thing where typically you grind your teeth or grit your teeth in your sleep, but it can also be caused if you grit your teeth when you're awake. And that's because your jaw tries to correct the unevenness in your teeth, apparently. Which, doing that can cause muscle pain. It can cause, like, a click in your jaw. It can cause, like, joint pain. It can cause facial numbness. It can cause a whole bunch of things. So when I went to the dentist, I sat down in the chair, and my dad was like, we think it's wisdom teeth. And so my dentist, looked at my last, I forgot what he called it, but essentially the x-ray of my teeth. He was like, it's a little early, but, you know, we can't rule anything out. So then he touched on my face a bunch, he touched on my gums a bunch, he touched on my teeth a bunch. I did another x-ray, and he was like, so it's muscle and joint pain. You essentially have TMJ. Don't open your mouth at capacity. Don't, like, cram food into your mouth. Try to, like, not do a hippo yawn. And I do all those things. I essentially have to rework my entire being of existence. No. But yeah, I need to be better, so that way my jaw and face don't hurt and aren't numb. But yeah, like, he touched where my wisdom teeth would have started coming in, and he was like, is it tender? And I was like, no. And then he touched, like, around my jaw. I don't remember where exactly, but, like, he pressed down a little bit, and, like, I jumped because it hurt so much. He touched on my temples. It was like, we're gonna order you a bite guard to wear at night, and, yeah. You have joint pain. It's like, great! And actually, hearing that made me feel so relieved, because my doctor, well, she's not really a doctor, she's a nurse practitioner, but my doctor was like, yeah, it's your anxiety, we're gonna up your medication, we're gonna give you this special medicine for panic attacks, because your anxiety's so bad. And then, I was like, okay, cool. And then my dentist is just like, you need to stop gritting your teeth. And I'm like, great! Yes! Finally! Because I do that subconsciously. I will, like, grit my teeth, and I notice the pain before I notice I'm gritting my teeth. I usually do it in math, and when I'm, like, in art. But, yeah. I think it's funny that, like, my doctor / nurse practitioner was like, yeah, it's your anxiety. My therapist was like, it sounds like an ear infection. And then my dentist is just like, yeah, it's joint pain. Went through all that work for nothing. So, yeah. If you're watching this and you're gritting your teeth, stop it. It can cause your face to go numb. That's a real thing, apparently. So, takeaway from this video. Stop gritting your teeth. There's a lot of things that can cause facial numbness, and maybe you should, I don't want to say not listen to your doctor, but, if your doctor says that everything is from anxiety, then maybe get a different doctor? I mean, you could just be having anxiety problems, and in that case, you should talk to a therapist about it, but, Not everything is from anxiety. So yeah,
What's with these
happy
homies dissing
Halloween.
my
Bye.
girl? Why do they got a front? Why do they ever do to these guys that made them so violent? Ooh, ooh, and I know I'm yours. Ooh, ooh, and I know you're mine. Ooh, ooh, and that's for all of time. Ooh-wee, ooh, I look just like Buddy Holly. Oh, oh, and you're Mary Tyler Moore. I don't care what they say about us anyway. I don't care about that.